Massachusetts is internationally recognized for its world-class hospitals, yet it continues to confront some of the highest healthcare costs in the United States. Republican gubernatorial candidate Mike Minogue identifies a clear correlation between these factors. Drawing on his extensive experience as a chief executive officer within the medical device sector, Minogue asserts that the Commonwealth can achieve greater healthcare access, reduce costs, and alleviate regulatory burdens by fostering innovation rather than relying solely upon government intervention. Central to Minogue's perspective is the principle of putting patients first. Reflecting on his leadership at Abiomed, he describes a culture in which every organizational decision was guided by the question of whether it would improve patient outcomes, facilitate the work of clinical staff, or generate savings within the healthcare system. Minogue emphasizes that excessive regulations impose significant challenges on nurses and physicians, suggesting that a strategic focus on reducing such barriers would not only enhance access, but also encourage the adoption of transformative technologies. Minogue points to his professional engagement with healthcare systems globally and his close collaboration with frontline clinicians as the foundation for optimism regarding the potential for a patient-centered approach to improve both quality and affordability in the Commonwealth. Acknowledging regional disparities, particularly the gap in access to specialized treatments between the greater Boston area and more distant communities, he highlights the closure of facilities such as the hospital in Norwood, which has led to extended travel times for emergency care. Addressing this, Minogue proposes the development of a hub-and-spoke model that extends innovative care beyond Boston, improving health equity statewide. From a financial perspective, Minogue argues that current regulatory policies concentrate expensive procedures in high-cost settings, rather than encouraging the broader availability of lower overhead outpatient and surgical centers. Drawing on his background in managing employer-sponsored health coverage, he underscores the unsustainability of persistent double-digit premium increases and advocates for reforms that would provide individuals greater flexibility in selecting the care most appropriate for their needs, while also implementing safeguards to protect families from catastrophic health costs. He notes the utility of health savings accounts and cost caps as tools for empowering consumers and controlling expenses. Recognizing the ongoing mental health crisis, Minogue proposes expanding access to counseling services by permitting greater reimbursement flexibility, thereby decreasing the reliance on emergency departments for mental health care. He expresses particular concern for correctional officers and veterans who are disproportionately affected by mental health challenges, advocating for specialized interventions to address acute needs within these populations. In confronting inefficiency, waste, and fraud within the healthcare system, Minogue outlines a commitment to rigorously identifying and eliminating unnecessary expenditures. He intends to link savings to value-based incentives for clinical staff, thereby aligning improved outcomes with shared financial benefits. Minogue, who recently secured the Massachusetts Republican Party's endorsement and is strongly positioned for the upcoming gubernatorial primary, asserts that implementing a comprehensive, patient-centered healthcare strategy will be essential to realizing both improved health outcomes and cost containment for the Commonwealth. Want to make sure you never miss our latest videos? Tap that follow button right now. If our content brought a smile to your face, made you think, or taught you something new, please like this video and share with your friends and family. Your support helps our